Hello everyone, welcome to the TA webinar for HRSA-26-036, Rural Communities Opioid Response Program. This is for planning. My name is Diana Wang and I will be hosting today's webinar. Thank you all so much for your patience as timelines have changed over the past few months. So just a couple of housekeeping items before we get started. Since this webinar is recorded, we will not have a time for live Q&A, but if you have any questions for us after watching this recording, please feel free to email us at ruralopioidresponse@hrsa.gov. Also, just a note, we cannot provide information or guidance beyond what is included in the NOFO, and we are not drafting any applications or providing feedback for any specific project proposals. So to access the full Notice of Funding opportunity, you can visit the link here. You'll want to select Package and then Preview and then Download Instructions, and that should download the full funding opportunity package. Just a note that this is only a TA webinar. To provide an overview of the NOFO, you'll want to refer to the full NOFO and the SF424 application guide for the full details and specific instructions for what to include in your application. So just some background on the history of RCORP. We've had RCORP programs since FY18, and we've had investments across 47 states and 3 different territories. We've reached over 2,000 rural counties. You can also visit our website to learn more about our different programs. So the purpose of RCORP-Planning is to build partnerships and create a strong base for SUD-related services. This is a planning grant, so implementing direct services is not part of the program. This grant is focused on foundational capacity building and strategic planning for your community. So here's a brief funding overview. We will award approximately 40 grants. Each award will be $100,000 per year, and the period of performance will be from September 1st, 2026 to August 31st, 2028. So please budget for the full $100,000 for each year. There'll be 2 12-month budget periods, so the total amount would be $200,000 for 2 years. So in terms of eligibility, applicants can include any domestic, public or private, nonprofit or for-profit entities. However, individuals are not eligible to apply under this NOFO. The applicant organization can be located in either an urban or a rural area. So in terms of completeness and responsiveness to the criteria, your application must meet these basic requirements in order to move forward in the competition. Planning activities may only support HRSA designated rural counties and census tracts. There's additional information in the NOFO about specific areas that were formerly designated as rural before the September 2025 data updates. Those areas are also eligible under this NOFO. You can refer to Appendix C for any additional details. And then in partially rural counties, activities must be limited only to the rural census tracts. You'll be expected to address the needs of the entire target service area that you select. So if your target rural service area contains any counties or any census tracts that are not designated as rural, your application will be marked as ineligible. It will not be reviewed or scored. So please, please, please include your service area clearly in your attachment 1 so we can confirm your eligibility. So there's also a list on page 7 that includes some completeness requirements to move forward for funding. You'll want to meet the eligibility criteria as I described earlier. Please do not request more than $100,000 per year. You must submit your application on time before the deadline. Your application must include a project narrative, a work plan, a staffing plan, a budget, and a budget narrative in order to be considered. Your proposed service area must be exclusively rural. Your application must describe a plan to address all 3 core objectives. Your budget should not include any funds for direct service delivery. And then finally, you must provide 2 letters of support 2 proposed partners, and each of them must provide a letter. So for the 3 core objectives, we consider these to be 3 specific areas of work that are necessary to achieve the program goals. So your project must include these 3 core objectives. So goal 1 is to support and develop a network of committed partners that will help establish and implement SUD services in your service area. And you can have different layers of partners, such as those that are core members and have MOUs, and then also those that are more so on the periphery. Strengthening this network will also help to make sure that what you plan for will guarantee shared commitment and resources to last over a long term. Goal 2 is to create an action plan and increase your SUD capacity in your service area with a plan that makes sense for your community. And then finally, goal 3 is to strengthen your capacity for your service providers and your organizations and make sure they are ready to deliver the services that your community needs. And in each of these goals should support and inform each other as you proceed during the project and implement your strategic plan. So we know every community is different, therefore this opportunity allows you to tailor how best to accomplish these goals based on how ready your local system is to deliver and sustain substance use and other behavioral health services. It is intended for rural areas that need more time to assess what is available and what is still needed in their service areas, and for planning specific activities to improve outcomes. The NOFA describes these overarching goals that are critical to creating a strong foundation in the service area. There is also flexibility in how you would like to accomplish these goals. So your project must include these 3 core goals. But if you have other specific objectives that you want to pursue in order to meet your local needs, you can put forward those additional objectives, but that's not required. Activities should also address the needs of the entire service area, not just the key population centers in a county, but also the more outlying areas, and work to address notable pockets of unmet needs, even where some services do exist. So we recommend you to carefully define your target rural service areas so that your application shows that you are fully assessing and helping to meet the range of local needs. You won't be scored on your proposed geographic or population size of your service area. And then finally, your activity should also advance 1 or more of the MAHA priorities, and you can find these on pages 11 to 12. So here's some detailed information on Objective 1. So for your network activities, you'll want to work together with your partners to complete the community assessments and then develop an action plan. The network will also be responsible for planning how to sustain these activities and start implementation of the work plan. And there are some examples listed on pages 13 to 14 of the NOFO. You'll want to make sure that your network and your outreach includes voices from the community, as well as those with lived experiences. This can include specific activities to engage those with lived experience in the planning process, such as community surveys, focus groups, or developing a board of advisors. Not all community members need to be full network partners in order to contribute. For your network expectations, you'll submit at least 2 letters of support from current or potential partners in your application. At least 1 letter must be from an organization that's physically located in your target rural service area. So just be sure to include their address when listing your partners in attachment 1. And then by the end of year 1, you'll be expected to have at least 4 distinct organizations with 50% located in the rural service area. And then you'll also have to have a written agreement for the network, such as an MOU. Network members should be fully engaged in your planning activities, and you should consider even budgeting funds in your application to support your partner's participation. And then as part of your project staff, there should also be a designated network coordinator just to organize network activities and meetings, and then to lead the group in joint decisions. The expectations described cover your primary network members who together share the responsibility for completing the planning activities and achieving the shared goals. But you can also have different layers of partnerships with a range of community organizations that want to be involved as advisors or even resources. There's a list of potential partner types on page 13 of the NOFO. It'll just be important to have partners that represent various sectors and different disciplines. So Objective 2 also includes two portions as well. It includes the needs assessment and an action plan. So in the needs assessment, it should include the prevalence or trends of substances that are in the service area, existing assets and availability of SUD services, provider and workforce availability, and as well as the financial landscape of how services are funded. If you or others already have some of this information, feel free to use it and expand it using this grant. So the needs assessment that you guys create should drive your action plan development. You'll have your network drive the action planning, but in close connection with your community. You want to make sure there's shared conversation. You'll also want to engage those with lived experiences and as well as your community stakeholders. This will just make sure that your planning responds to the local context and promotes local buy-in, as well as long-term sustainability of services. You'll want to leverage expertise and resources from your network and take best practices from similar communities in your area. Part of your action planning should be how to include sharing data and resources with each other and the broader community. Your action plan will be due before the end of the project period, but this is a living document and we hope that it will change and continue to be refined as you take it back to your community and start implementation. Last objective should only be moved forward when the initial action plan is completed. You may use funds under this objective to prepare for service implementation, but not to start service delivery. Activities under this objective will help fill gaps and begin implementation of your community action plan. The activities should align with your community assessment and your action plan, and we expect that this objective will mostly happen in year 2. So some example activities include purchasing necessary equipment or supplies or materials to enable service delivery, training providers, establishing effective and efficient service processes and procedures, or initiating minor renovations of your service space. However, your needs assessment and action plan you'll need to be able to justify these activities. All these activities are to put systems in place for when service delivery and implementation starts. So some of these activities will need HRSA prior approval before you begin. So here are some additional expectations and restrictions to keep in mind. This grant may not be used for any direct service delivery. That includes providing SUD prevention, treatment, or recovery services. And we recognize that opioid use is not the only substance, so please feel free to address polysubstances, including alcohol, as well as other mental and behavioral health issues. The target population includes those at risk, those in recovery or treatment, their family and caregivers, as well as the community members impacted by SUD. We have repeated this over and over again, but please be sure to engage members in the target population meaningfully across all your activities. Additionally, all services should support the service area in terms of SUD services. We expect this program to help sustain and build the project's elements after the grant ends. We'll also have a TA provider and an evaluator, and you'll be expected to work with them throughout the period of performance. And then part of your TA, we will have mandatory bi-monthly learning collaboratives where someone from your staff must attend. And then finally, please disclose if you are participating in your state's CMS Rural Health Transformation Program. And if you are, please ensure that there's no duplication of services. So for staffing on this program, there are 4 required roles, but you may decide the job qualification and the level of effort needed to fulfill these duties. Staff can serve multiple roles, but all these roles must be included in the staffing plan. So please include the project director, who will be the primary point of contact. This person should be regularly attending our monthly check-ins and reporting on how activities are going. You also want to include a data coordinator, a learning collaborative point of contact. This can be the project director or the data coordinator. And then lastly, there needs to be a network coordinator who helps engage and support the shared work of the network. So just a couple of general limitations, and you can find more information on these links, but they go into more detail about what costs are allowable versus unallowable, what costs are reasonable, necessary, or allocable. You may not earn a profit from the federal award, and then there is a salary limit of $228,000 as of January 2026 that applies to this program. Here are some additional limitations under this grant. You may not use funds for activities that do not support the rural service area. You may not purchase property. You may not purchase drug paraphernalia. This includes pipes, syringes, needles, or supplies to facilitate drug use. There's no construction allowed. However, minor renovations are allowable. You may not pay for any equipment costs that are not related to the purpose of this grant. There's also guidance about proportion of funds used for these purposes in the budget section. And then just briefly for indirect costs, you can select one of the two methods. The first method is approved rate. You must provide an approved cost rate that is approved by your federal agency, or you can just select method 2, which is the de minimis rate, and that is 15% of your direct costs. And to apply, you must be registered in 2 systems, SAM and grants.gov. You must have an active account with SAMS.gov to apply, and registration can take several weeks, so please begin that process as soon as possible if you don't have one. So here is an overview of the application components. The page limit is only 30 pages, so your response should be clear and to the point, focusing on prompts we provide and what reviewers will assess. Be sure that your application includes an abstract, a project narrative, a budget narrative, as well as the required attachments. So for the project abstract, please just include a short description of your proposed project, as well as a basic description of your target service area, the focus area of community SUD needs you plan to address, and any types of partners you plan to work with. This summary may be shared publicly on websites describing federal investments if you are awarded. The project narrative will include the meat of your application. The introduction is just a brief description of the purpose of your project and an overview of your service area and current partners. The needs section should make clear what specific needs are in your target service area and why this funding will help you meet those needs. And then the approach section is where you'll detail the major activities of your project and how you will achieve those goals. Some other sections in the project narrative include the high-level work plan, where you will just give an overview of specific activities that you'll be implementing and how they will work together over the course of the project. And you'll need to include a more detailed work plan in attachment 2. The resolving challenge section, you'll want to discuss potential challenges and how you will adapt and resolve them. And then for the performance reporting and evaluation, please list specific outcomes you like to see and how you plan to track those, as well as a system of how you will collect data with your partners and report to HRSA in your community. Another big push is to build data capacity in communities, to gather data that helps understand the needs of the community, set goals, and track outcomes of your efforts, and ultimately report on activities to HRSA and other interested parties. And then finally, the last section is sustainability. It will be important to discuss your approach to implementing your action plan after the planning grant ends. The intent of the planning program is to launch long-term effort in developing and delivering a strong system of behavioral health and supportive services. And for the organizational information, you want to provide an overview of your organization, your role in the project, and the relationships and capacity of your organization. And you can include an organizational chart in attachment 3. So for your key personnel, please describe your staff and the required roles and expectations, including details for each position in attachment 4. And then you'll want to include a biographical sketch for each of those staff in attachment 5. And then since workforce is always a challenge, you'll want to include information on how you'll retain staff and how you'll manage staff turnovers and vacancies. And then for your network, you'll want to ensure that the whole service area and partners are engaged and actively participating in the project. Be sure to include one letter of support from each of the two partners as part of attachment 6. And as mentioned, at least one of these partners must be located in the target service area. And then as you build your full network, at least 50% must be located in the target service area. So for your budget and budget narrative, you'll want a breakdown of each of the costs in your budget and justify why and how these funds are being used. Please budget for the full $100,000 for each year. You also want to consider travel, sustainability, your network partners, equipment and supplies, or any renovations you possibly want to make in year 2. So please keep in mind that these requests require additional approval from HRSA before you can spend these funds. And then we also encourage applicants to budget for their network partners and other community contributors, such as people with lived experience, to enable their participation. And then finally, here are the list of attachments that are required. So please be sure to include attachments 1 through 6. Attachments 7 through 15 are optional or only as needed. So attachment 1 is where we will locate a lot of information to see if your application is eligible and complete, as well as provide priority points. So please be sure to include all this information here. Be sure to include all the details about your service area, including census tracts of partially rural counties, the rural addresses of your partners, and whether you are a current or previous grantee. Attachment 2 will be your work plan. We highly suggest applicants to use a table to create their work plan. You can organize your plan with objectives and columns to include the activity or task, the responsible staff, the start date, the completion date. We included an optional template that you can use in Appendix A. You'll want to include all 3 objectives and have the work plan reflect a 2-year period of performance. So now attachment 3 will be your organizational chart. So please be sure to include partner organizations if you know. Attachment 4 will be your staffing plan and job descriptions. You want to include a staffing plan that includes name, job title, organizational affiliation, FTE, roles and responsibilities, and timeline for hiring. We also highly recommend using a table format for this attachment. There's also an optional template provided in Appendix B. So attachment 5 will be the biographical sketches for each of the staff listed in attachment 4. Please make sure their qualifications match the job description. Attachment 6 will be the letters of support. You'll need to provide 2 letters of support from current or potential network partners. Each partner should provide a separate letter, and at least one of the letters should be from an organization located in your target rural service area. Please make sure the letters include all the information asked for on page 40. So attachments 7 and 8 are included only if they apply to you. Attachment 7 is for organizations that are submitting more than one application under the same UEI. The project must be different and service a different service area. Attachment 8 is for applicants who participate or benefit from your state's CMS Rural Health Transformation Program. This information will not be reviewed for scoring. All the information needed is listed on page 41. You can view the whole application review process on pages 45 to 48. Our initial review will be to check for completeness and eligibility. If it meets all the requirements, your application will go to the merit review, where review panels will score your application based on the review criteria listed in the NOFO. So reviewers will score applications based on the review criteria, which includes attachments that are listed in the project narrative. Each narrative section is linked to a review criteria, and here is how the points are distributed. So please be sure to adequately address each of the sections to answer what is being asked for in the review criteria. Introduction need will link to 20 points in the need review criteria. The introduction, approach, work plan, and resolving challenges will link to the 30 points in the response. The performance and reporting and evaluation will be 10 points. The approach, work plan, and sustainability will link to the 15 points for impact. The organizational information and evaluation will link to the 15 points for resources and capacities. And the budget and budget narrative will link to the 10 points for the support requested. And the total amount of points possibly that can be earned will be 100. So these are the funding priorities for this funding opportunity. Funding priorities are the points that are added to your score if we determine that your application meets the listed criteria. We will determine priority points based on what you indicate in attachment 1. So you'll receive 2 points if you are not currently funded by RCORP, and 2 points if you have never been funded by RCORP. We do have a couple of reporting requirements for this grant. There will be an annual progress report, and we'll give more information on that later. There will also be an annual performance report. This is where we'll collect specific data related for your grant. And then finally, you'll need to submit your strategic action plan before the end of the grant. And we'll provide more details about that after the award. So for application logistics, here is a link where you can download the NOFO. You must apply electronically. The page limit is 30 pages, and this includes the project and budget narratives, the attachments, the letters of support. So keep your application focused on what the NOFO requests and be concise. Standard OMB approved forms and indirect cost rate agreements do not count towards your page limit. Pages provided beyond the limit will not be reviewed. The application deadline is provided on the grants.gov page for this opportunity. Please pay close attention for this information. We will not accept any late applications, so please register in sam.gov and grants.gov and submit early in case you run into any issues. So here's the program contacts. I will be your program contact, and you can find my email here. Eric Brown is our grants contact, and he will most likely answer any questions regarding budget or grants policy. And then if you have any questions regarding grants.gov, please contact our support desk. So this brings us to the end of our webinar. Thank you all so much for attending. Please reach out if you have any questions, but we look forward to receiving your application. Thank you.